We will call this meeting to order. Meeting has been noticed to Evans Print and Media Group, WCOW Radio, Magnum Radio, La Crosse Tribune, Sparta City Hall, and Sparta Free Library. Are there any changes to the agenda?
No.
I move that we adopt the agenda as presented.
Second.
We have a motion and a second to adopt the agenda. All those in favor signify by saying aye.
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 Opposed? Motion carries. All right, first item up is going to be public comment. Just going to set the rules out of the gate here. Each individual is going to get 2 minutes to speak. When you have 30 seconds remaining in your 2 minutes, I'm going to kind of give you a hand wave, a hand raise, whatever I can to kind of let you know. We will not have a repeat of October, okay? If that starts happening, individuals would be ejected from the meeting immediately, okay? So when somebody is speaking, nobody else in the room is talking. When that individual is going back to their chair, nobody is making comments, okay? We will not have a repeat. So, first item up, our first individual, Johanna Pipkin. Oh, yeah. And just as another thing, when you're speaking, please speak into the mic so that way everyone up here can hear you as well as on the Zoom as well.
Oh, I don't think you guys will have problems hearing me.
Okay.
I have a loud mouth. All right, I am Johanna Pipkin. I'm a school district employee, a wife, and a mother of 3, which one has graduated from here and 2 are in the high school. I'm speaking tonight about what I see as a parent and as an employee, reference the mask mandate. As a parent, my 2 boys, like I said, are in this high school. They wear the mask, but they think it's an inconvenience and a ridiculous rule. They both, if they had the choice, would not be wearing one. My husband and I keep it to their choice, and they just decided that it's just a lot easier not to go against the river, and I told them that's fine, because it's not their battle to fight. Now, as an employee, now I'm speaking for myself. I'm not speaking for anybody else who works for the district. It's what I see and I observe. I work in a secluded classroom, so what I do see, I'm like the flower against the wall. So I see a lot more than probably somebody inside, because I'm looking from the outside in. So now, like I said, I'm not only speaking for myself. I'm speaking from my point of view. The mask mandate thing is a battle that I don't want to battle. There's a bigger battles I'd rather fight than the masks. For example, making positive relationships with the kids, helping them prevent behaviors, and help them stop with the power struggles. You may say, this can be done with a mask, and you're partially correct. The negative relationships between staff and students usually, this year, stem from enforcing the mask, which then leads to behaviors and power struggles. You may say, this isn't happening. Or, this is an easy fix, just report them, write them up. Well, this brings up another power struggle. I don't know half of these kids that are walking around the middle school. I have no clue. So if I say, C, I think that's your name. What's your name? I'm either going to get told off, not get told, walk away. I can't tell, they have a mask on. And the only reason I know that's C is because I grew up with them. That's the only reason. So then you have a power struggle. They're going to turn around and start arguing back. And that's not worth it. That is not worth an assistant's time, a teacher's time. That's a time where you can say, good morning, how are you doing? How was your evening? Did you get breakfast? Did you get lunch? But no, we're worried about if the mask is above our nose, or if it's not on properly, or if we don't even have one. So the mandate should be a choice, because the kids who are going to wear them are going to wear them. The parents that want them to wear them, they're going to wear them. The other ones, they won't. And well, right now, half of them don't. Because again, power struggle. The easy solution is drop the mandate, make a choice. Make it a choice for all the kids and employees. For all this being said, hopefully you're listening with open minds. not from personal feelings, not from biased views, and not just listening to what I'm saying, what to everybody else tonight is saying, the emails you've gotten. Listen to them, because that's your job, right? To listen to what we have to say and go with that, but not personal feelings and not biased minds. So believe it or not, we all are all together. We are working for the same thing. We're there for the kids, for positive experiences, for help controlling these behaviors that we heard about. So thank you for your time and Merry Christmas.
Thank you. Next individual, Dominic Arico.
Hello, thank you for letting me speak. As you just said, I'm Dominic Rico. I'm a retired person in town, a homeowner and property taxpayer for 20 years. I'd like to talk about the mask a little bit, and then I have another topic I'd like to cover that was covered on the last school board meeting that I attended at the middle school. For starters, I don't know if anybody's aware of it, but 4 days ago, Colorado rescinded their mask mandate. I assume that's in the schools too. On 10 days ago, Pennsylvania rescinded their K through 12 mask mandate by court order by a judge, state judge. I don't know if we need to do that in this environment, but I know talking to my granddaughters, especially my youngest one, who's very front and honest about what's going on. She loves going to school, but she hates wearing the mask, period. She's happy as a student. My oldest granddaughter, happy as a student. And she's conforming because she wants to be a part of the yes people. But if you really ask any of them, they'll all say they don't like it. I graduated here in '74, and I would have been one of those kids not wearing a mask. As you see, I'm not wearing one now. I have 25 years of medical lab in the military training, in nuclear, biological, chemical warfare. And that's what I trained for war. And I think we're living in a war environment right now. You're treating the kids like they're in some kind of prisoners. I get it. Everybody has their own agenda and ideas on what these masks do for you. If you want to read about what they're doing, this is a really good book, Truth About COVID-19, Dr. Joseph McCullough. The foreword was written by Robert F. Kennedy Jr., pretty smart guy. In fact, he just wrote a book, came out days ago, The Real Truth About Anthony Fauci. This is a good book. Everybody should read this book. This is cross-referenced by Nobel laureates, hundreds and hundreds of doctors worldwide, top scientists. This is serious information in it. Okay, other than that, we're being lied to. This is from a PowerPoint from the FDA last year, October 22nd, last year. And this is Dr. Stephen Anderson, PhD, presented this at the FDA last year. You can find this online. That's where I got it. And this is page 16. Page 16 is very telling. I found out of this is from Dr. Brian Artis out of Texas. It basically says everything what the mRNA gene therapy shot can do to you, and it's doing to people all over the world. On the back page of it is all kinds of references that where you can find out the truth of what's really going on. And I have enough copies for all you board members. If you'd like, please feel free to review them.
All right, thank you. Next individual, Pat McKenna.
Good evening. Can you hear me okay?
Yep.
Okay, I know I'm not the loudest talker in the room. 20 months ago, we were handed COVID, global pandemic that none of us knew anything about. We didn't know how it spread, who it affected, if a vaccine would work or when it would be developed. We didn't know if COVID was going to be the end of society or a blip on the radar that 15 days to slow the spread would cure. You were forced to become scientists and virologists. You were forced to do risk-reward analysis of education versus a child's life. in our own lives. Decisions for myself and my family were pretty easy, but I didn't have to weigh thousands of other families, thousands of other opinions. I credit the 5 of you that are here from the original 7. I have to believe that you thought maybe stepping away like the other 2 would have been a good example. It would have made your lives a lot easier. You made these decisions using the resources available to you at the time. Anyone pointing out your failings after 20 months of hindsight isn't being fair to you. So I won't. I want to look at the reality of our current situation and find a way to create a win. Now, we have 20 months of acquired knowledge regarding COVID. We know that mitigation efforts work. We know an effective vaccine is possible. We know that COVID is not going away, but it can be controlled. And we know that this isn't the end of society. But maybe the most important thing we've learned is that people don't like to be mandated. We all know that one guy that will try to hold his breath if breathing was mandated. People like to be educated. They like to make decisions and feel that they're there for their best of themselves and their family. If you came to buy a car from me and I told you which one you were going to get, you would tell me I was nuts. If, on the other hand, I inform and educate, I explain gas mileage, warranty, safety, value, and performance, maybe you would choose the same car. But in doing it, you'd be confident your decision was best for yourself. We can't get back the last 2 years. We can't fix the mistakes we made due to lack of information. But we can make a conscious effort to get to our mission and values and educate. Voting to end a mandate doesn't mean there's no law. It doesn't mean it's the Wild West. It means that people have the ability to take 20 months of knowledge and make informed decisions. Maybe you as educators educating be more effective than mandating. Thank you.
Thank you. Next individual is April True. And April, I know Brad intended to give you his time. That's not something we do, so 2 minutes.
Okay, well, I was going to come here and give you all the reasons to end the mask mandate, but I've realized it doesn't matter what we say. It's been clear at these meetings that the majority of people do not want a mask mandate. You can go anywhere in Sparta and see that the majority of people are not masking. Every other district in Monroe County doesn't have a mandate. You've also taken away public input at committee meetings. You don't want to hear from us. Now you're about to ask taxpayers for a $2 million referendum. You want the same people you didn't listen to about masking their children and the same people you don't want to hear from at public input to listen to your needs and vote for a referendum. We need a referendum because revenue is down. Well, last year, Sparta had a net loss of 220 students that transferred out of our district. That's about $2 million. 2 years ago, before COVID, our net loss was 143 students, which is already high compared to all the other districts in the area. But these restrictive COVID policies we've had have made things worse than they already were. Several districts in our area saw an improvement in student transfers since 2018. They're getting our students. You need our vote for this referendum, but you've lost our trust. We see you in public and your families without masks on. I see it at events in the gym while all the staff here is masked for 14, 15 hours a day. You said that once every school-age child can be vaccinated, you'd end the mask mandate. That happened mid-November. We're here in mid-December. And now I'm hearing that we're gonna pick a date, possibly at the end of January, to unmask or unmandate the mask for these staff and students. Please end it immediately or minimally as soon as they get back from Christmas break. We don't need you to worry about our COVID exposure over Christmas break. You worry about the education and policies that are going to keep staff and students here, and let us worry about the health and well-being of our students.
Next individual, Amy Lopez.
Good evening, board members. I am here again tonight to encourage you to remove the mask mandate effective immediately. While the mask mandate attempts to reduce the risk of exposure during school hours, there is no light switch that stops the spread of COVID at the schoolhouse door. As soon as the bell rings, those same staff, students, administrators, and even board members hang out with their friends, hug, play sports, engage in conversations, ride in cars together, go to friends' homes, share meals, vacation with other families, etc., unmasked. Keeping or removing the face mask policy tonight will not likely affect anyone's holiday plans, nor should that be your concern. When discussing the need for adequate resources, Dr. Van Duren recently said that children do not get to do a grade over. Well, no child in this district has had a normal or complete education for the past 2 school years. Years they will never get to do over. Although it is neither your authority nor your responsibility to be concerned about families getting together at Christmas, you do have the authority and responsibility to promote the best educational experience and environment for our children. Your decision to remove the face mask policy tonight will give teachers and families the opportunity to reclaim the remainder of the school year free from unnecessary politics. It will also give you an opportunity to get back to your duty to promote the education of our children. Thank you very much for your time.
Thank you. The last 2 individuals we have are through Zoom. The first individual is going to be Michael Bonello.
I come to you today with a Spartan way and a common good request. My name is Michael Bonello, resident of Sparta. I have a master's of public health degree and 40 years experience in healthcare with 37 years experience administering the care of the elderly. 17 of those years at Morrow Home Community, where I retired 4 years ago. I have a 6-year-old grandchild in Minnesota who is required to wear a mask while indoors in school. I am here to advocate for masks in the Sparta School District for children who currently have access for a COVID-19 vaccination, but because of Monroe County's low vaccination rate of less than 50% and a COVID transmission rate 6 times a high rate, all are susceptible to COVID. The Sparta Area School District has a wonderful philosophy titled The Spartan Way, Respectful, Responsible, and Safe. I believe the Spartan Way applies to all within our school district: teachers, students, parents, other school employees, administration, and the school board, and should apply to the community. So I ask the school board, do you believe and do you follow the Spartan Way? Are you respectful of science? Remember, science does not compromise. Science wins. Most importantly, Sparta School Board, are you being safe? My 40-year management philosophy was summed up with one question: what is best for those we serve? Or as my Christian faith compels me to ask, what would Jesus do? Sparta School Board, what is best for those you serve? In your heart, you know masks are the best option for our students until vaccination rates increase and transmission rates decrease. In 1905, in a 7-2 vote, the Supreme Court upheld a smallpox vaccination mandate. Justice John Marshall Harlan wrote in the majority opinion, quote, "A community that has the right to protect itself against an epidemic of disease which threatens the safety of its members," unquote. Or in other words, personal freedoms should never supersede, quote, "the common good," unquote. This opinion is still on the books. Thank you.
Thank you. Next individual is Justin Treacle.
Hi, this is actually Mindy Treacle, his wife.
Sorry.
That's okay. At the beginning of this school year, the school board was negligent in their duties to implement a mask mandate for our students. This resulted in an emergency meeting 1 week into the school year in order to implement what should have been done from the beginning. The active cases for the district was at its highest without masks being put in place. Once masks were put in place, active cases and percentage of students in quarantine stopped spiking. Since masks have been put in place, the percentage of active cases within the district has not risen above 1%. If you take masks away, then the percentage of quarantine students will spike, and eventually the entire district will go back to virtual learning. This is not ideal for anyone. Additionally, what is the percentage of fully vaccinated within the county and surrounding areas? So specifically, school-aged children. The vaccine has been available free of charge for everyone over 5 for a couple of months now. If this community ever wants to get the people who are in favor of masks to drop the mask issue, then the community needs to get vaccinated. The school board and district should require this vaccination at the beginning of next school year, as you do with other vaccines, such as MMR, tetanus, and others. But we should not need to revisit this mask issue for the remainder of the school year unless school-aged children vaccinations are above 80 to 90%. Why would we do away with masks since they're showing to be effective, especially with the onset of cold and flu season here? It would make no sense as a community to do away with the mask at this point in time, unless, of course, you simply do not care about other people. And for those of you in this community who sent death threats to the school board following that September vote, shame on you. You are the reason we are continuing to have these emergency meetings and discussions on a topic that really shouldn't even be debated at this point in time. Do better, be better, and live the Spartan way of being respectful, responsible, and safe. Thank you.
That is it for public input. So the next item, discussion and possible action regarding the status of board policy article 904, face coverings in school. All right, so back in, was it October? I think we had the discussion on when we would revisit this issue. And at the time it was 4 weeks after the vaccine became available to our students in the county. So even though the vaccine was out first week in November, it wasn't available in our hospitals here until 2 weeks after. So 2 weeks after, or 4 weeks after that period, here we are at that date, okay? So going through this, I'm gonna put a motion on the floor to start. So we can have discussion based off of that, and we can see where that goes. So my motion is retroactive to January 24th, face masks will be highly recommended for all staff, students, and visitors when in district buildings. Okay, that removes the mandate, but still says they are highly recommended. And it gives a retroactive date to January 24th. Okay, why do I pick that date? Okay, if the motion is going to be tomorrow, my vote's going to be no, straight period. Okay, I'm not going to be the reason little Timmy can't go see grandma at Christmas. And it's just a week between now and Christmas holidays. There's no reason to put that undue pressure on families as they need it. The reason I'm picking that 3-week period after coming back from the holidays is it removes the undue burden on our staff when dealing with quarantines and whatever else, contact tracing and something else that would have to go through for after that holiday season. Okay, so that's why I'm picking that date. And it also gives those parents who are still on the edge, if they want to get their kids vaccinated or not, that is 6 weeks from now. That is what it takes to get the full retro virus or the retro or the vaccine series of shots. So that's my motion. People can yell at me, scream at me.
I'll go first. So I apologize for being late. I was in attendance at my 5th graders' Christmas concert. So
It'll be excused.
okay. So you all know, I watched these 5th graders get on stage with their masks and sing these 2 wildly out of tune Christmas carols. But it was fabulous to see. And as these children are standing there, the music teacher says, everybody smile big, but you can't see their faces. You can't see those smiles. I attended the high school Christmas concert last week or 2 weeks ago with the band. I watched my kid fidget with his mask the whole time he tried to play saxophone. okay? I like what the teacher did with putting the cuts in the masks, but the fact that my junior played with his mask the entire concert, it bothered me. It bothered me immensely. So today, in English, my 11th grader sends me a message. He says, "Mom, there's a big meeting tonight, right?" I said, "Yeah." He goes, I said, "Why? What was the conversation in your classroom today?" He says, "Well, we'd like to make it optional, but I will still wear a mask because my girlfriend's father needs me to wear a mask." I said, "That's awfully adult of you, son. Thank you for that." So in this discussion, I like your proposal, Josh. Everybody wants to drop the mandate, but there are no ideas how to move through the next few weeks. My proposal is to make masks optional and to send out a waiver. If those parents and those students choose to wear a mask or don't choose, we create a waiver that they have to sign that if you're going unmasked and you by chance catch COVID, you're not going to come back on the district for it. I was at the Packer game on Sunday. 78,000 people did not have masks on. We are living in two different worlds right now, and I don't get it. You're out on the weekend downtown Sparta in the Chris Kindle Market. How many people do you see wearing masks? And yet they teach and they send their kids to school every day in the masks. I was for it in the beginning, and now an hour ago, I watched my kid sing with a mask on his face. Excuse me if nobody else gets emotional, but I have kids in the district and I've been watching this and I've been seeing the struggle, and it bothers me so much. So that's my opinion. That's all I have to say. Thank you.
Josh, I'll second your motion for purposes of discussion, but I'm not necessarily supportive of it. But I believe in order for this to be an organized discussion, we need to have that second. I would much prefer to see to have an action that clearly defines a goal for removing the mask mandate, but also has in place parameters for when it may need to be returned. And so that we're not setting just arbitrary dates, but it's based on something. And I was looking at our district's statistics as far as positive COVID cases for November and December. And what I did is I looked at a 5-day rolling average. And so at the beginning of November, we had approximately 3 cases a day for that 5-day rolling average. By the end of November, it was about 4.5. Into December, we started with about 5 cases a day for that 5-day rolling average. And we've had as many as 7. My suggestion would be that we consider setting a goal that when the 5-day rolling average is 2 or less, then immediately we say you don't have to wear your masks. We don't have to wait for a meeting. We don't have to set some date in the future. Similarly, we say that if that 5-day rolling average reaches 3.5 positive cases, then immediately or the next day, those masks go back on until, again, it falls below or 2. This way, we know what the goal is. We don't have to be poking ourselves in the eye every time we set a meeting to talk about whether or not it's time to remove the masks. COVID is not going away, at least not for a long time. And so we're going to be continually having these types of meetings. My fear is, sure, we could decide to take those masks off, but the problem is not getting better; it's getting worse, and I think we're just shooting ourselves in the foot, because as uncomfortable as these meetings are, if we have to come back in February and put those masks back on, it's going to be even more uncomfortable. And I sympathize. I don't like wearing a mask. No one likes wearing their masks. No one likes mandates. But we like to say in this district that safety comes first, that's our priority, keeping our students safe. I think it's pretty hard to just say we're tired of these damn masks and safety be damned. And I'm sympathetic to the idea that we will lose votes in the upcoming referendum over this issue. But if it's a choice between safety and votes, I'll take the safe route.
So I proposed a similar thing to that way back in August. I asked, what is the percentage of students in the school or classroom? What percentage does it have to get up to sick kids before we have to close the school? And I believe the answer was 20 or 30%. So would that be a more viable option versus 2 or 3? Because I don't think we'll ever get back down to 2 or 3 students that could be or maybe or quarantined.
I don't know enough about this idea of 20%. That seems pretty high. So what you're saying is 20% of the students would need to be out?
Correct. Before anything happens, if they close the school or that classroom is sent home for virtual. That to me seems like a more realistic than 2 cases in the district.
We're talking 2 new cases
Mm-hmm.
in any one, in the day. A 5-day rolling average. Some days there will be hopefully less, but some days there would be more.
I'd like to put clarification on that. I'd like to put clarification on that 20%. What was discussed was 20% of the students in a building, and that building was going to be shut down. That's the route we used with Southside when this whole thing started. It wasn't 20% on, whether we wear a mask or anything like that. And I believe the discussion, and Amber could correct me if I'm wrong, but I believe the discussion was centered around what the state was dictating to us as a school board. I don't know, maybe Amber, you can comment on that. That's what I took out of the meeting, that 20%, because it was a communicable disease type deal, and the state dictates, how we're doing it.
Correct. When it comes to closing of a classroom and or potentially a building and moving it to 100% virtual, it depends on the spread and how it's spreading within the building or within the classroom. So if they're tracing several positive cases to a case within a school, that's where the health department or the state may consider looking at closing a building and or a classroom for a period of time to reduce the spread. But Ed, you are correct on the rest of that.
Thank you.
Absolutely.
Couple comments. First of all, I like Josh's idea. I came here today thinking that if we weren't going to move on this next week, I wouldn't be in favor of it. But after listening to the rationale, I'm totally in favor of what Josh is proposing. Gives everybody time to prepare, gives parents an extra time to rethink if they want to have their child vaccinated or not. As far as, for me, it's going to be, okay, we're at this percentage, we're at that percentage, we're putting the mask on, we're taking the mask off, we're putting the mask back on, we're taking the mask back off. I can see the principal's offices being full. I can see the staff being stressed out when the next day we're masked up and half the students show up without a mask on. I think it's going to create a lot of confusion. I think it's going to create a lot of stress on the staff. So I'm opposed to that. We're at a time and a place to where we need to start moving forward. The mitigations that we have taken in this school, in all of our schools, whether it's the water fountains, it's the cleaning, it's the air filtration systems. People have now had a chance to be masked or vaccinated. The adults for up to 5 months, I believe. And now the students have had an opportunity. People need to be able to make their own choices. If you want to wear a mask for extra protection, you put a mask on. If you don't, you don't have to. But these should be decisions that these students and their parents can be making. It's very difficult for me to hear people that are pro-masking and take a look at the newspaper and they're standing there next to students without a mask on. It's very frustrating to go into a county building, a city building, any other government building in the city of Sparta and not see a mask on. Yet our children have to have a mask on. To me, we're demonizing them. These people they got to have a mask on or we're all going to die. I don't get that. And then you walk out the door and we can go anywhere in the world, not anywhere in the world, anywhere in town, and basically be able to not have a mask on, which they do immediately when the school day is over and they're not on a bus. Those things come off. So my position is I support Josh's motion. I'm not in favor of, setting all these parameters up of when we put a mask on, when we don't. We need to learn to start living through this because I heard it tonight. This isn't going to go away. There's going to be another variant coming down the road. And then there's going to be another variant. And then there's going to be another variant. And it's going to end up being like the flu. But in the meantime, we're going to lock all these kids up with a mask. And for me, it doesn't make sense. Thank you.
Go ahead, Colin.
First, I just want to say thank you to everyone that shared public opinion. Thanks, everybody. Again, same thing I said in March and June and August. Like, this is hard, and no one knows if we're going to make the right decision until 20 years down the road, right? And so I just want to throw that out there. I think a couple. I'm not going to try to reiterate some of the things that have already been said. Also, just kind of want to start with our current policy, right? Ends at the school day. So all of what we've experienced is knowing that we haven't been as preventative as we could have been. And so the cases we're seeing now, the quarantines might be lower, right? If we had enacted that fully. I think other pieces that come up for me, just the stats of the decision to have masks has kept more kids in school and more employees in school too. And that to me was one of our priorities, right? That was what people asked last spring, like in person versus virtual was the issue. And now it's masks versus no masks, right? And so I think the fact that the masks have kept more students and employees in person, especially when we're looking at statistics from other communities, right? To me, that goes to student learning, and that's what we're about, trying to keep students in that space where they learn best and not going virtual, not going hybrid, because no one wants to go back to that. I think a couple other pieces, all right, the masks help reduce the spread there. I'm not going to emphasize the low vaccination rate in the community, 45%, those are all pieces that we know, and we know that there's data that shows vaccinated or unvaccinated people are more likely to be hurt and harmed more deathly sick, right? More hospitalizations, more use on ventilators. So that's another layer for me of this decision that we make doesn't just impact the 3,000 students and 470 employees, it impacts the larger community. And we know that people aren't following mitigations outside of school, right? Like that's openly admitted. And to me, that's more of a reason for us to be safer in the space that we can and should be safest in. I think the other layer that comes with that is, and we saw it in other places in the country, I mentioned it in October, but our local hospital systems are at capacity. People are being turned away from La Crosse and being sent to other locations, right? Because of needing to get the care that they need. And so that's something that, again, I have a hard time making a decision that would likely contribute more to that already unsafe situation. The case rates are high right now, right? That's pretty obvious, and it's worse now than it was before this year, earlier this year. I think doing our part to keep the community safe, right, makes a lot of sense. But I also think resonate with what Mr. Hendricks said too about creating a system that's less reliant on our personal biases and quite frankly, the politics that have made this an issue, right? I think being able to put some data to those so it's not just, you know, I appreciate everything that you're saying, but we can't rely on missing the smiles or, right, we can't decide we're done with it because we're sick of it. Everyone is. Like, that's not unique, and it's also not unique to Sparta, right? It's worldwide, and those numbers from how unvaccinated are being impacted translate to other communities, other places. And to me, those layers make more of a reason to us to set some of those data-driven parameters for us to revisit masks, not only for removing them, but then also putting them in place again, right? If that's a route we have to go. Because if we learned anything the last 20 months, it's that this thing changes. And if we make a January 24th date decision now, a lot can happen between now and then. And so that's part of my hesitation on selecting a date, 6 weeks out now, knowing that if the case rate skyrockets, like that has to be part of our consideration because we don't operate in a vacuum, right? Our students go to other places, our employees go to other places, as has been pointed out. And if we can keep everybody as safe as we can in our district, in our buildings, to me, that makes a lot of sense. I did go a couple steps further with kind of setting some of those parameters, or at least trying to take an attempt at it. And so a few of the things that I thought should be in the discussion for when we make this decision, vaccine percentages, right? I think now that we've gotten the breakdown, I think it was reported that only about 10% of students 5 to 11 or in the kids 5 to 11 are vaccinated right now. We know what the rates are for the other age groups. To me, getting that number closer to 80s and 90s, I feel a lot better about making it optional, right? And a lot better about giving that choice back if we know that the vast majority of people are going to be safer as a result of the vaccination status. Community case rates, I think those are pieces, again, that should help trigger a review of Policy 904. So I also put in some timing to kind of what Mr. Hendricks was saying. And so my numbers were a little bit different, 28 daily case rate for the county, right? And 107-day case rate for the county. But I would also like to see us maintain that for 2 or 3 weeks at a time before removing it, instead of saying we had one good week and then have that be a potential to, right, go back and do more damage there. So I put that extra layer of time consideration to help us ensure that the rates are going down a little bit further. The hospital systems, the percentage of the ICU beds that are full, I put a number there too, and that's the one that I think we can work with our local partners, Monroe County Health, our local hospitals, to learn more about what that specific number should look like. And then lastly, the other layer that all of these I think should be in the conversation, not just one criteria or the other, is just the district cases. And so similar, I thought that whenever we can have 5 or less positives or 15 or less quarantines, right, for 2 or 3 weeks in a row, to me that tells us that we're on the downward trend, hopefully. And so those parameters aren't going to depend on what news source we're watching or what this person feels or that person feels. Like, those are hard statistics that tell us that we're in a better position to remove the mask. So I'm going to stop there, but I think those are all pieces that are coming up for me that hopefully we can
Mr.
consider.
Lydon?
Go ahead.
Okay. A couple of things that I hope the board keeps in mind as they work through this decision. First of all, positive on the January 24th is that it gives us some time to implement, because once we make a change, we may lose some staff, we may have some families switching in and out. I mean, all of this takes time, right? To think about how that's going to look. Let's not forget that we've got 3,000 students plus staff that we're taking with us, and so the shifting on the fly is really, really challenging. One of the things that I've learned in the last couple of years is that it's really hard to go back and forth. And once we loosen up, it's really hard to tighten back down. And I can tell you that going through the mask policy process, the due process, has been an incredible burden on our principals and our administrators, family by family, to ensure that we're giving everybody their due process. So as we're thinking about all these things, please take into consideration, or at least have some wonderings about what this is going to look like in real life, regardless of the decision you make. And I would also remind you that back in June, I believe, the board decided that there was enough information, you guys had enough, that this was a decision that the board wanted to make specifically. I put it out there, and I'll put it out there again, that if this is a decision you would like to delegate, I'd be happy to take it, because I know that it's difficult. And if you want to take it, I'll support that too. But please think about how it's going to look in practice. And that's all.
I like how you're optimistic of the 80% vaccination rate. I think we could give that 5 years, and I think we'd be lucky to get to 50 to 60%. So I think those vaccination rates are unrealistic in this time. And those case rates, I mean, when you look at it on a day-to-day basis, if you go back 2 years, I mean, we had more colds and flus. I mean, and we're just talking about one sickness where we got to have two cases a day or lower. Well, why is the flu any different? Why is the cold different? Why is XYZ different? Especially when it comes to how it's treating the kids, especially with this new Omicron variant, where they're saying it's essentially the cold. I mean, I don't want to lose sight of all these different variants that are coming out, and they all mean different things. So right now, everything's Delta, but in a month from now, everything might be Omicron. Hospital rates may be basically nothing, yet we still have 60 cases of COVID, but it's the cold. I mean, when you go your just normal cold and flu season, I mean, if we only had 60 kids a day with a cold, that'd be a heck of a school day. I don't remember the last time we've even seen rates that low. That's the reason I don't like using just those numbers, because as we've learned with everything with COVID, it's not stagnant, it's ever changing. If you're gonna wait for us to be able to nail down some set of criteria that's always gonna work and it's never gonna change, all we're gonna constantly do is move the goalposts again and again and again and again. And I'm done moving the goalposts.
Josh, I think the thing is, we're not there yet, though. Policy 904, we say we're at a time of moving forward. We're not even close to a time of moving forward right now. All right. Yesterday, 7 new cases. Today, 5 new cases. You talk about struggling watching your child fidget with a face mask. Try watching your child fidget in an ICU bed. Oh, and you can make faces and whatnot, but it's true. We go down to the Children's Hospital in Madison. There are kids fighting COVID-19 right now. There are kids that are fighting other diseases and other illnesses and other sicknesses that don't have a bed right now because of those types of situations. Doesn't matter. We wear a mask to protect the students, the faculty, and the community in this district. That's the goal. Now, I like the January 24th idea, but I don't like having it be the end all be all. I don't think that makes sense. And for a number of reasons said by multiple people on the stage here, if we have high cases, it's going to be impossible to move back on this. I mean, we're setting a precedent for failure immediately right out of the gate. So establishing a plan that maybe is implemented, and I'm not even saying that doesn't have to be implemented now, like Mr. Hendricks is saying, but I think to have a goal to shoot for makes way more sense than just saying, well, I'm tired of waiting for people to get vaccinated, or I'm tired of having the same discussion. When it comes down to it, we have our students wear masks to try to protect them and grandma who's sitting at home and the community that's out there as a whole. Mr. Hendricks, you brought up a good point. I also had a threat that stated somebody may not vote for that referendum if we keep masking in place. I think it's important that the community understands that the state government level has placed the freeze on the student revenue limit for the next 2 years. Every school is going to be facing the same type of deficit. Okay, so the only ones that you're hurting when you make that choice to do a no vote to something like that is your students and your faculty. It's not about a mask. And that said, I mean, I wouldn't be willing to barter any one of my student, staff, or community members' health and safety just to get that referendum vote. So I know it's a bold statement, but it's two totally different things. We wear the mask to protect the students, the staff, and the community. So I think a plan is better suited as compared to an end-all be-all.
Can you hear me over there, Heidi? Close enough? What I'm hearing tonight is, and I'm in favor of it, is that last year at this time in January, we made a diligent decision to deviate from Monroe County Health Department based on not what Toma's doing, not what Holman or La Crosse is doing, but what is the effect on our education and our organization here in Sparta District. And we did it systematically. And the reason we did that systematically was because of the fact that we wanted to limit the liability to the school district. There were many people that were putting up lawsuits throughout the state for people that were wearing masks, organizations that were wearing masks, and also there's organizations that were suing because you didn't do the masks. You know, I hear people, you know, in the community, you know, we've gone down this road for what, 2 years now, with everything going on. What I guess I compare it to is this, is that if we're going down the road, we need a roadmap. We need a plan. I agree with, you know, what has been said so far as, okay, if we're going to deviate, we have to have those parameters put in place in case something happens. And COVID's not going away. You know, my heart goes out to the families that have kids in the ICU buildings. I mean, it's a very difficult decision, and our role in this matter, because Washington DC and Madison can't put on their big boy pants and decide whether or not this is what should be done. They only suggest. So they kick the can down to us. I've heard all of this. Nobody, including me, likes to wear a mask. But I put the mask out of respect and safety of the students. And it is very true. The community doesn't have masks on. And to go ahead and dictate who gets infected when, in what building or what, puts a heck of burden on Amber and Monroe County as far as tracking. I don't want to make that burden any more than what it is. Just because we remove the mask or make it mask optional, however you want to put it, we still have to track our students when they get ill. So there's an expense to that. There's time to that. And if I remember right with conversations that we got a lot of, cameras that help us with the tracking, but the hours that goes into that tracking. And if we remove the mask, we don't remove that tracking system. And that's going to be more burden on Amber and the folks that help with that. COVID doesn't stop. Miss Lopez went ahead and said that COVID doesn't stop at the doorway. Yeah, right. It doesn't stop at the doorway. But our responsibility starts at the doorway. That's what we have control over. And it's very distasteful to a lot of people about this, requiring masks. But that's our job. Our job is the safety of the students. And I think everybody up here has the same feeling. Different philosophies, different way of going about it. But I think in order to go ahead and make a logistical, logical platform, we need to go ahead and have a plan. I agree that, if you want to have a date, our January and our regular meeting to make a drop dead date, one, I would ask that data, as Colin put it, statistics, if you want to call it, we get with Amber and Dr. Van Dern, and we get the statistics down. We already have feelings down already. That there's no doubt about that. But we have to make a logical decision based on data in order to go to the next step, just like we did in January. And I'll refresh the members that are brand new, is what we did was we made masks, everything, right straight through every time somebody came into the building. And that went with athletics. And as we went ahead and made a logistical, logical decision, we only had the team and the coaches there. Well, then progression of it was, we're not seeing any increase. We could probably go ahead and have the parents come, because there was an incident where one of the students went ahead and fainted or blacked out on the thing. And they made a good point. The parents made a good point. Why can't we be in the building? And slowly and surely, everything went stair step. That was a plan. That's what I suggest we do now. We come back in January. Everybody's back. In the meantime, it gives people chances to get the vaccination, because I tell you what, it may be out in the news that it's available, but our student body may not be getting it because they don't have the opportunity to get it. This will afford them more time to go ahead and get vaccinated or decide what they want to do. It gives administration time to go ahead and give us a logical plan based on statistics or data that we have in our district to go to that next step, to unmask or make it optional or whatever step we decide as a board to do. But we base it on facts, not feelings, but on facts. And that's how I can't approve the fact that, you know, the motion of, you know, okay, January, we're going mask optional, because a lot can happen. And I think it's a big burden that we're going to be placing on our administrative staff to, you know, reorganize everything and get everything squared away. And I think it's going to be a catastrophe. We have to have a plan, and a well thought out plan. It worked last year. Lessons learned. Let's keep with the program and do the same thing, make a map. That's all I have.
Just have one thing to add that was on the other page, so I missed it before, but I think the other recommendation that I would put out there is to have us, either as a board or create a COVID-19 task force, but to meet more regularly to focus solely on this issue. I think if our employees and our students are being burdened by this, I think we can do more there too. And I think that would be another piece of helping us stay on top of it. So it's not something that, right, we don't go a month or two between conversations. It's something that we're always having on that front of the radar. Not that we're not, but having that dedicated time to solely focus on COVID-19 makes a lot of sense to me, especially outside of, right, this space in a more work-centered environment. So that was another recommendation I had there.
I guess with that what more, I mean, me personally, I read the news all the time. I'm looking at our numbers, I'm looking at Cashton, I look at Toma, I look at West Salem, I look at Anna. That's me on a daily basis. What more data do you need at this point? I mean, between the news and everything else that's available right now, the news slaps you in the face whether you want it or not. The data is there. I mean, my whole thing is, when we keep talking about, you know, the vaccine, we all say the vaccine works, right? The vaccine works, why are we still doing this? If the people don't want to get it, that's their choice. That's what this country is about. They get the choice. If they don't want it, all right. The rest of the people that took that choice and said, hey, let's do it, I want to go back to normal.
Well, I think everybody wants to go back to normal, Josh. I'm not saying that, but there are people in this community that cannot get a vaccination for a medical reason or some specific purpose, primarily medically is what I'm stating. And, you know, it's our job to take care of the students, and we can't just be tired of being respectful, responsible, and safe. I understand that it's tiring, it's exhausting as board members up here, committee members. I get it. I mean, you guys have been at this a long time. I'm new to this, and you know, I haven't gone through what you've gone through, but we should never get tired of being safety oriented towards our staff and our students. And so if we're in the middle of a pandemic, which we are, I don't think being tired of something gives us just an excuse to say, let's just drop it and go optional. So I think having a plan is the way to go. Now, again, the panel or committee or whatever that may be, to continue to help with the statistics, making sure that the community has access to the statistics so they're seeing what we're seeing. I believe that transparency is important, but to think that we're there right now, or that we're gonna make an assumption that we'll be okay and be there on January 24th, I don't feel that would be responsible of us, and I feel like being tired of it is not a good excuse to just say we're going optional. So I like the January 24th date, but I feel we need to have a plan in place. And I am open to whether it's Mr. Hendricks, Mr. Burns Gilbert, how we get there is important that we lay that out, but I don't think we just say we're there on January 24th.
Any further discussion? James?
You know, this thing with data has been there from day one. And I remember when this all came out, my wife made me leave our groceries in the garage for 2 days. I could only go to the grocery store one time a day. I had to have my mask on. Anywhere I went, I was supposed to have a mask on. As we became more educated about this whole thing, we relaxed a little bit more. And as time went on, I just brought the groceries in the house. And I can go to the store without a mask on. And when I take a look at the school, when this first thing came out, the governor mandatorily shut the schools down. I mean, this thing was a death sentence. And we either had to do all these things or people were going to just start, you got it, you were dead. Well, that's not the case. We were still in red. When was that, Josh?
January.
Last January. We were still in red. And we decided to push through that and come back to school. Okay? Had we known today, a year ago, we would have probably been in school with a mask on. Okay? But we were virtual. We were behind the 8 ball. Most everybody else was doing the mask, except for La Crosse County. People were doing the mask. They had their kids in school. All the mitigation processes came into place. We kept pushing, and I think it was the right decision to make. I think we need to be, I don't want to live in fear. And that's personally, after all this time and seeing how we're progressing through this, the fear number keeps coming out. More data, more data, more data. It's almost like this is a business. People are profiting from this. Whether they are or not, I don't know. But why do we keep throwing out more fear? More fear. We don't want to move forward. We want to move back. When Josh talked about getting tired, I guess I'm tired of all the fear that gets thrown out there. People have a choice. They can get vaccinated. People have a choice. They can come to school with a mask on. These are decisions that people should be making at home with their children. And we talk about, somebody brought up the referendum. You know what? It's their belief that this thing isn't as bad as it is, as we think it is. That's their belief. And if we're going to be going against everything that they believe in, they've got choices to make. Whether you think they're the right choices or not, they have a choice. So I think we need to think about this, and we need to start moving forward. We vote on this today, it goes to the board tomorrow, we've got a month. Well, we've got the holidays, but the school district has a chance to make preparations. People know that this is going to be optional. They've got an opportunity to go in and get vaccinated, if it's that big a deal to them. These are all choices. It's what this country's about, is choices. And we're mandating. At some point, people need to take responsibility for their own actions.
Mm-hmm.
Thank you.
Nicely said, sir.
Any other comments or questions?
Josh, I got a comment to make.
Go ahead.
I hear you, James, you know. That's what makes the decision so hard. Moving forward, you know, for me, is moving forward is having a plan. I by no means am stressing fear in the public. The community has, like it's been said tonight, the community is not backing the mask. I mean, it's evident. The issue for me that stands out, and Dr. Van Duren and can go ahead and chime in on here, is the liability side of the house. Anybody can sue us anything, you know, and we had a discussion about liability. One of the responsibility is liability of going ahead and having a lawsuit come before the school board individually or the school district. And our insurance carrier is not going to pay for it.
I'm sorry, we make our sports teams sign concussion waivers. Why can't we have a COVID waiver? Isn't that what protects us from those lawsuits? Are those signed waivers? I don't know, correct me if I'm wrong.
Dr. Van Duren.
This is far too nuanced an issue, unfortunately, to give you a black and white answer. If the district is found negligent, a waiver is not going to matter, likely. Although that's, again, has to go through the process. So let's say if you're going to go kayaking, you sign the waiver that says that if you get injured, you're not going to sue the kayak company. Well, the kayak has a crack in it, and it's taken on water, and you have an accident and are injured because the equipment was faulty. That waiver that you sign doesn't protect against that. So that being said, the courts have not decided this issue yet. I do know that following CDC recommendations gives us the leverage to say that we have done everything we can to keep students safe. However, the law is about risk.
Mm-hmm.
And what is the level of risk that the district is comfortable taking?
So the fact that we have spent the whole last year putting in protocols and processes, all these mitigation plans, does that not show that we have not been negligent in moving forward?
It's definitely evidence in our favor.
Okay.
Absolutely.
So, and kind of going off of your comment there, Heidi, that's why we went through the process where we were masked up until now. We waited for the vaccines. It's not like we did this willy-nilly and we said,
right,
hey, just screw it. There was a process we went through to give everyone that opportunity that wanted it.
Mm-hmm.
And to me, that proves that we went through and did the process of negating the risk that we could.
Yeah, but the liability, we're creating the liability by deviating from the CDC guidance. The guidance is universal indoor masking by all students age 2 and older, all staff, teachers, and visitors to a K through 12 school, regardless of vaccination status. That is the CDC guidance right now. We're deviating from it, and we're asking to deviate further from it, which is going to create further liability.
Well, we deviated from it last year as well in January.
And maybe that wasn't a good decision.
And how many
but it
districts
is what it
around
is.
us are deviating from it currently? And do they have lawsuits filed within their school districts?
What was the last thing you said there?
How many counties or school districts around us have lawsuits standing right now as we sit here?
Yeah, I personally am not concerned about the liability issue. And I don't think any of us should be concerned about the liability issue necessarily because it's so wide open. I think that we need to get back to the motion and make a decision on that, which will either end the discussion or then we can move on to a different solution. I think we've all had an opportunity to air our views on this. And I don't know that anything's being gained here at the moment.
Is that your point of order, John, to call the vote?
I move the motion, yes.
We'll second that.
Well, we've already got the motion and the second on the floor.
Can we repeat the motion, please?
So retroactive to January 24th, face masks will be highly recommended for all staff, students, and visitors when in district buildings.
And there's no parameters set to that, correct? Just as of January 24th.
Correct. And it was put in motion by me, seconded by John Hendricks. Roll call.
Are you kidding me? Yes.
Mr. Hendricks,
No.
Mr. Lydon,
Yes.
Mr. Burns Gilbert,
No.
Mr. Schulte,
No.
Mr. Rasmussen,
Yes.
Mr. LaCasser.
I don't have enough information or data or a plan in place to make a legitimate discussion, so I'm going to abstain.
I don't think you can do that, can
Oh,
you?
yes, you can. You read the state statutes, ma'am. Elected officers can do that, and they don't have to give an answer.
So you're going to abstain from this very important vote right now at this
You
moment in
bet.
time?
You bet. And I gave
Then
you
what
a
was the
reason
last
why.
hour? What did we just do the whole last hour?
The last hour was to get an answer.
Is there any
My
more
apologies.
discussion? Otherwise, I'll just entertain a motion to adjourn because I don't think we're getting anywhere tonight.
Well, I would make a motion that is similar to yours, except I would like to see something in, set as part of that motion that gives us direction for if things go to hell in a handbasket, that we're going to go back to masks without having to go through a long, torturous discussion.
And I'll second that.
And I'm open to what that would be. Colin had a suggestion. He's smarter than I am, but I see things getting worse, and we take the masks off, and then something happens, and then we have to call people back together for this. I just think that's unwise.
Well, I would just say we revisit it next month and we have this entire conversation yet again.
And that's what I'm trying to avoid.
That's what that's what we can avoid with a plan.
Well, I'll tell you from an enforcement standpoint, if that's a policy where we're going to look at a data point and however we pick it, that we're going to say, hey, that's when masks are coming back, you are putting administrators in a horrible position for enforcement.
And then you're going to have that rubber banding effect, like we're on, we're off, we're on, we're off, we're on, we're off. Like we've all said, COVID isn't going anywhere. And with all the different variants, God knows what's coming down the freaking pike in terms of whatever.
So the new motion is the January 24th date, but with some parameters, correct?
With a parameter for at what point do we need to put the masks back on? Yes, and I don't have a suggestion. I'm certainly open to suggestions for that.
Okay, so Ed seconded that vote. What does he suggest? Or that motion, excuse me.
I seconded that, yes.
So what, do you have a suggestion, or are we just gonna willy-nilly it here?
All right, I'll
We
throw
need.
one out. One possibility would be to go back to the 5-day rolling average. And to Dr. Van Duren's point, earlier I said, then the masks go back on. If you need time to prepare for that, we say then when that point is hit, 2 weeks after you go to the mass. I don't care. Whatever is needed and appropriate to prepare for that, I'm fine with that. I just think, as I said, things are going to get worse, and to not be prepared for that eventuality to me is short-sighted.
I would suggest that we had a system in place when this started. We had a color system. We tried to do the automatic pilot thing. And when the board last June, now granted, this is a different board, made the decision that the board wanted this decision, it was to get away from exactly this sort of formulaic, are we on or are we off? And to James's point, we were in red when we went backwards because this is a very fluid situation. So for what it's worth, I don't think it's that much, if we're looking at a 2-week lead time, to call a meeting about this if you need to, if the board is truly going to make this decision.
Either way, I feel that a decision has to be made today.
I'm not trying to push this off on our administrators, but is there any input? Dr. Van Duren, I've heard from you. Ms. Kulig, is there any input you would like to add to this? Ms. Hauser, Ms. Brigman?
Got to make sure I have that on. From my standpoint and my role within the district, I have a due diligence to follow guidance. So any recommendations I would give would be following CDC guidance due to my role within the district.
Well, I don't mean to put you on the spot, but could you just go through what some of your ideas were again, please? I'm sorry. There we go.
That worked? Yeah. I think don't know if I said this too, but these numbers were all a starting point, right? I think Josh, you mentioned, right, those vaccination rates aren't realistic. I think definitely something that would make sense to adjust and revisit. But I had the vaccine
Colin, could you
rates.
speak up?
What's that?
I can't hear you.
Oh yeah. There we go. So I had the vaccine rates as one criteria to look at, the community case rates, so both the daily case rate and the 7-day case rate. Again, things that are being tracked by our Monroe County and other health professionals. The hospital system, ICU capacity was another data point, and then the district cases, right? So the district's positives and then quarantines were other data points. And again, I threw these out there as a starting point for discussion. And so I think any of those make sense to me, but there's some that I'm not thinking of, I'm sure, that might make more sense to include or take some out. But again, trying to not have this in the hands of our, how we're feeling, and more so being able to justify that decision to go optional. And I think those will help us in that long run.
So how many cases, because we pulled masks in June, correct, if I remember correctly, how many cases did we have during the summer school, during the time of summer school? When it's hot and humid and heavy, what was the case? Do we have any data on any of the summer school numbers?
I can get that for you. It would just take me a minute to take a peek at that. Keep in mind, when school's not in session, we don't necessarily get all of the case information. So
Right.
It's hard for me to say if it's accurate or not,
Mhm.
but I can definitely look at what that is. But again, it is just what is reported to us when school is not in session.
Correct. Thank you.
Yep.
So Josh, I got a comment to make. If we use the drop dead date, and this, maybe Amber, you can address this here. COVID is I'll generalize it in a statement. We know a lot more about COVID. COVID is a contagious disease, and it's not going to go away. We did in last January, we diverted from the red scale and made our own scale. Would it not make sense to use a similar process to go ahead and divert from what CDC has, because it would be showing that we're doing a deliberate, logical decision for the board? We, correct me if I'm wrong, but we had a chart, with, go and no go, as far as the whole COVID deal. Couldn't we use that same format now?
Sorry, sometimes this is hard to turn back on. I'm not sure which one specifically you were referring to, but when I look back at January, so again, we've been collecting the data from the beginning of the pandemic. When I look at that time in January, when we did make that switch, just as a comparison, the county was in red. Our daily case rate was at 29.85. And then that following week, we dropped down to orange and it dropped to 22.49. So cases were going down in that January timeframe when we did make that adjustment. So a week later, we were down to that orange where we would have gone to the next plan within our color system that we had.
Dr. Van Dern, would that give you some assurance as far as in the administration of the school district for planning? If we were to utilize that, somewhat of that criteria? Because it's an infection rate and it worked for us in January, and it was a process that worked, and so why recreate the wheel?
I think that sounds promising. I'm a little concerned when we start spitballing with data points at this juncture where we haven't had a chance to really sit down and unpack it. So what I'm hearing is a certain amount of anxiousness to come up with the decision right now. And so I'm not going to give you an answer when I don't have, for a question that is a deep question, having received it 2.5 seconds ago. Confer to the team. If the board would like, we could certainly come back next week with some thoughts about how this could work. We have gone that route before. And again, I remind you that back in June, the board kind of took this over. So I think the idea of using, if there are data points, if there's a stop-start rate, I'm telling you that if we have to start up again, starting mass back up this fall is the single hardest thing that we've done as a district.
Well, there's got to be some sort of compromise
I would like to put a motion on the floor. The motion is that we look at a date of January 24th to make masking strongly recommended with parameters put in place that to give us some guidance on how we're going to deal with this based on the numbers, what you were talking about, John. And come back at committee in January and have the administration and maybe a board member or two be in on the conversation to present to the board. And if it's something that we can agree on, then we can move forward to the 24th.
Was that your intent, John?
One thing I would amend to that, James, is if the criteria failed, all it would do was trigger a special meeting.
We
As-
can, we
as
can deal with,
opposed
we can,
to-
Josh, we can deal with it that time.
Okay, if that's,
We've been in this meeting way too long. I think people are burning out. I am. I don't know about everybody else, but
amen. Okay,
So can you re-say that one more time, James?
that we set a target date of January 24th to come back, masking strongly recommended with parameters in place that the administration and maybe a board member or two can sit down and formulate a plan so that we have something to work with moving forward. And the parameters that I'm talking about are what John was talking about.
So, Mr. Rasmussen, if we're not on a 5-day rolling average, less than 3 positive cases, that drops that's the parameter you're talking about. If it's not below that by that committee of the whole, then we don't discuss this.
I don't think he's setting a parameter at this
Okay,
time.
okay. Well, I think he just
What did
said
I
he was
say?
going to utilize your
Oh.
parameters.
Right.
What
Or
was I saying?
create a subcommittee or a group with the administration team and 2 board members
Yeah,
to
I'm-
come
I'm
up
not-
with those
I'm not saying
parameters in
anything
front
right
of
now.
the January 24th
I'm saying we
date.
have some people put together some ideas. We'll brainstorm all night here right now and then bring it to the committee meeting. The first
In
committee
January.
meeting in January. If it's something we can agree on, I'm not sure when the full board is, but if the 24th is prior to the full board meeting, we can have a special meeting to put it in place.
Well, and it would
So-
be the full board meeting, so
So essentially, we're giving the administration time to come up with a plan, and we're tabling this decision until the next committee meeting.
Well, the decision that would be tabled is
The parameters.
what's going to trigger masking, if I understand the idea. But I have a question. Dr. Van Duren, what, in your opinion, will be harder, more onerous for the district? Keep masks on, or to take them off and have to face the possibility of putting them on again in the future?
oh, that is a tough question.
Yeah, I'm sure that it would be.
Um,
Because I'm
honestly, keep them on. The fluctuation is so hard. Going back and forth is so hard. And not knowing when things are going to flip is really hard.
I withdraw my motion and move to adjourn.
second. We have a motion and a second to adjourn. All those in favor signify by saying aye. Aye. Opposed?
Nay.
Nay.
Well, then people need to start talking.
Trying to think of how to change. I like the direction James was going there. So
Me too,
Trying
yeah.
to think of how to phrase that, and almost just taking off the January 24th and coming to that 11th with those ideas to then make that decision for if it's the January 24th or later, right? We'll be closer. We'll know more rates at that point, right? I think that's kind of the direction or what I was playing with in my head on how to reframe that motion.
Do we have time to put together a subcommittee and to meet before the January 11th committee of the whole and just make that a topic on that agenda where we make that decision? Amber says yes.
So let's withdraw the 24th completely. Let's see about having a subcommittee, just as James had stated there, that can give us information on January 11th that will,
Come hell or high water, we will make a decision January 11th.
I like it.
Is that a motion, Heidi?
Yes, so moved.
I will second it. We We have a motion and a second for what Heidi just said.
Can we
No,
know for
it
sure
can't
what-
just be that.
what you
Creating
said?
yeah, please, Heidi, elaborate. Just so we have it on the books.
So I move that we create a subcommittee of administration team members, teachers, students, and 2 board members to come together to determine the criteria that will be needed to move forward. That decision will be made at the committee of the whole meeting on January 11th.
Josh seconded that. Okay.
Question, who's going to organize the subcommittee?
This lady right
Okay.
here.
For those board members that would like to be on it, please let me know. So it kind of goes through one funnel.
Sure.
All right. All those in favor signify by saying aye.
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 Opposed? Motion carries. I'll make a motion to adjourn.
Second.
We have a motion and a second to adjourn. All those in favor signify by saying aye.
Aye.
Members of your administration team and
Ed, you can call your committee of the whole back in.